Seeing none. Seeing none. Very well, good. We'll move on to our presentation for today. And during the 101s, you heard different agencies talk about how they would have to requalify the Medicaid recipients over the next 12 months. So this is one look at how that may be done. So we're going to have an informational presentation on eligibility verification. And I'll call to the podium Bill Rowe.
Oh, are we good now? Okay. My name is Bill Rowe, and I recently joined Equifax as the Director of Government Relations for 9 states, including Kansas. I appreciate the opportunity to speak with you today. I'm joined by my colleague, Mark Delanty. He is the Kansas Account Executive for Equifax, and he has been with the company for 17 short years, and he's based out of St. Louis. We represent over 14,000 employees dedicated to a single proposition to help people live their best financial lives. We are excited to share more about the work we currently do here in Kansas. When people hear the name Equifax, many think of us as a company that provides credit reports for lenders when someone is applying for a mortgage, a car loan, or a credit card. And while we do that, and we do it very well, we are much more than just that. We lead the data industry in providing human resource data, analytics services, verification of employment and income for both the public and private sector. We manage unemployment claims, tax matters, employment and income verification services for over 82% of the Fortune 500 companies. We also provide other outsourced human resource functions such as I-9 compliance, W-2 and payroll processing, ACA management, and employee onboarding. Today, we'll outline the services that Equifax Workforce Solutions provides government agencies in their administration of public assistance. These verification services assist in eligibility determinations, reduce improper payments, increase staff efficiency, and improve overall service. Current employment income information is critical in enrolling clients in benefit programs. Unfortunately, many state agencies and federal agencies don't have access to the most up-to-date information. Using outdated wage data to set benefit levels leads to over and under payments and also makes those agencies susceptible to fraud and abuse. I'd like to emphasize that using real-time automated data also benefits the consumer by allowing the acceleration of the process of benefit qualifications and alleviates the need for the collection of excess paperwork. Again, I appreciate you allowing me the opportunity to speak today. And now Mark Delanty will discuss with you what we currently do in Kansas and some of the additional services we may be able to provide. Thank you.
Welcome, Mark.
Thank you, committee and legislators, for having me. Appreciate your time today. As Bill touched on, I'm Mark Delanty from St. Louis, Missouri. Been with Equifax 17 years. Been with the state of Kansas as an account executive, I think, since the inception of the contract, or at least on and off. So, but as Bill touched on, I'm here to talk about sort of the overall relationship we have with KDHE and DCF, product suite we have. And so I'll just tell you, Equifax is very proud, extremely proud to have almost a decade-long relationship with the state of Kansas. We specifically partner with Kansas Department of Health and Environment, as well as Department for Children and Families. Kansas has primarily relied upon our employment income verification tool, which is called the Work Number. They use that tool to assist benefit eligibility determination, redetermination, and program integrity for their SNAP, TANF, Medicaid, and child support programs. Kansas leveraged the Work Number last year to access over 835,000 employment and income verifications in real time through our web portal and through their API integration into the Kansas eligibility and enforcement system called KEYS. So I'll do a very quick overview of what the Work Number is. It's the nation's largest up-to-date employment and income database, representing more than 70% of the U.S. Non-farm workforce. It's updated directly from employers. Employers send us that data, we house it, and then verifiers, request the data. We update that every single pay period. As a result, that Work Number database provides a greater level of reliability and timeliness than any other data sources. It contains 150 million active employment records on the database, active employment records from 2.5 million employers across the U.S. The Work Number provides real-time eligibility data that's just not available through other data sources. So as Equifax continues to invest, in expanding our capabilities, the department uses the Work Number, but we are continuing to evolve. And when we're talking to state and federal agencies, we're wanting to broaden our offering to these various agencies. And so we have actually added additional services. So Contact Complete, as well as incarceration intelligence, in addition to the Work Number. And so these new data sources offer access to additional information to further help benefit eligibility determination, redetermination, and overall program integrity. I'll provide a brief overview of those two new services, Contact Complete and incarceration intelligence, in a moment. But please know that combining the Work Number with that Contact Complete and incarceration intelligence data delivers better tailored benefits to those in need. It improves administrative efficiencies for both agencies and the caseworkers, reduces beneficiary time and effort and confusion spent on applying. It reduces the number of applications denied, potentially not having insufficient data or lack of data and documentation, and enables agencies to deliver benefits more quickly, more accurately, and with an enhanced caseworker support, because they're not spending their time doing manual processes. And so Contact Complete, what is it? It's a data source that provides agencies with the most recent contact information. Just think address, phone and email information, as well as indicators for death and marital status. Contact Complete covers 95% of the U.S. population. We have access to 295 million unique individuals. This information is important to agencies because it allows them to accurately locate their evolving beneficiary population to determine if beneficiaries should be removed from benefits based on a change in address or death status, for example. Without automated access to Contact Complete, and agencies reliant on self-attested information from the beneficiary or older, outdated federal and state wage data that's sometimes quarters in arrears. And basically, by using that older data and or self-attested information, it significantly can impact benefit eligibility determination. It can impact program integrity, as well as just the proper distribution of the state's benefit dollars. Incarceration intelligence is very similar to the Work Number. It's the largest nationwide incarceration data network. We're covering 85% of all incarcerations in the U.S. It's coming from 2,800 jails and correctional facilities that source that current incarceration status data. And furthermore, incarceration intelligence represents more than 160 million historical booking records. And so why is that important? The simple fact that current incarceration allows agencies to suspend benefits if someone's currently incarcerated, and find out that they are released and put them back on benefits so that they've got that safety net available to them upon release. All of these data sets provide important information to agencies even in the state of normal business operations. But when access to this data helps these agencies conduct effective eligibility determinations, improve continuity care, and reduce churn to maximize caseworker efficiencies and expedite benefit delivery. But that's in the normal state. This data further assists these agencies in this non-normal state where we are now of operations, where agencies have experienced extreme resource restraints, If we've seen during COVID-19 pandemic, and we believe we'll again see at the end of the PHE public emergency coming to a close. And as part of that coming to a close, I'm sure as the committee is well aware, in April 2023, a recent change in federal law now allows states to begin redetermining Medicaid enrollees' eligibility, a process that states are calling and the feds are calling unwinding. Because of the PHE and the waivers and the fact that we could waive redetermination, states have not been able to disenroll otherwise ineligible individuals or require the states to actually perform eligibility determinations for Medicaid. And so specifically here in Kansas, as of the fall of 2022, there are about 500,000 people on Medicaid, which is a 30% increase from the beginning of the pandemic in March of 2020. So as the PHE ends, Kansas faces the requirement to redetermine eligibility for entire Medicaid population, including what is essentially a backlog of redeterminations for those enrolled during the pandemic. Leveraging automated data sources, as we just discussed, is critical in helping these agencies, such as KDHE and DCF, quickly work back to normalized caseload numbers while not disturbing or delaying eligibility decisions for any new applicants. I'd like to also briefly, in addition to the work number, in addition to contact complete and incarceration intelligence, briefly mention that in our partner ecosystem, we have access for state agencies to get information around financial asset data, property data, education data, tax information, and adult household composition. This assists agencies calculate an applicant's collective assets, determine various other benefit program eligibility, and comply with policy-specific requirements. As states' needs and priorities have changed, especially in the light of the pandemic, Equifax is also continuing to evolve. We previously introduced our evolution, I talked about our evolution into the new data sources, but we've also evolved a model by which the states consume our data. And so I'll elaborate a little further on that. Historically, states have leveraged a single data source, such as the work number, at application or renewal. And so for example, Kansas currently will request an employment and income verification per policy when they need to at the point of application or during a renewal or recertification, and we'll send back that data based on that request, and we'll only send back that employment income verification. So this occurs in a point of time via batch, via web portal, or through the keys API integration. But we believe, and what we're seeing out there is that the next evolution, some states are adopting, Missouri's about to go live on it, they'll go live in Q1 here. The next evolution introduces a function that allows Equifax to actually monitor and return alerts for designated life changes that could impact one's eligibility and offers a more holistic picture of an applicant or beneficiary. So Equifax provides these alerts to the department only on important life changes tailored specifically to the agency's own policies and thresholds. So the agency themselves then take that information and make an eligibility determination or review and see if they need to make a change in the actual benefits and if they're eligible any longer. So this basically is used for renewal purposes and at eligibility, and it avoids the churn. I'm not sure if anybody's aware of what churn is, but churn is where someone actually applies, gets turned, their benefits are turned off inadvertently through lack of information or lack of the most current data. They have to reapply, and that puts quite a bit of burden on call centers and just in staff, especially in this time with so many people being on benefits. And so the ability to use these, near real-time to real-time data sources at the point of application and renewal allows you to eliminate a lot of churn and keep people on benefits that truly deserve benefits, or if they do not, to suspend them and remove them. So that next evolution can be accessed in the same way I mentioned before, either through a web portal, through an API integration, or through batch uploads. And so with that said, we do have a couple of clients that are moving towards this model. We're talking to several more, but Missouri, as I said, is going to go live in Q1 on the continuous monitoring concept where they will be notified of changes as opposed to having caseworker either by just, reading through process or training manuals to know when to look at various data assets, but they will be served those per program and per policy proactively. And then they can manage that workload and actually prioritize that information as needed to make an eligibility determination or to approve or deny a renewal or recertification from SNAP and Medicaid. So with that said, thank you for allowing to share our perspective today. We regard state agencies like KDH and DCF as critical partners, and we know all of the challenges they have been through in the previous 2 to 3 years. And so with this committee and the legislature's support, we look forward to playing a continued role in helping Kansans receive their benefits in a timely, efficient, and accurate manner. Thank you again, and I welcome any questions.
Thank you, sir. Committee, what questions do we have for our presenters? Representative Droege.
Thank you, Chairman, and thank you for your presentation for the second time.
I'm sorry you had to say.
I just was curious about how many dollars the state pays you. I think it's pretty efficient. It's got to be more efficient than the caseworkers looking it up.
Yeah, so I can provide some more detail around ROI, but our contract right now is just under $3 million. We served 835,000 employment income verifications, and that's just employment income. It doesn't include any of the other data sets, and they're requested one at a time. Without using the work number, we've shown ROI upwards of, I will say 20 times the spend that Kansas is doing. A lot of that, I will tell you, and from our perspective, is that ROI is in Medicaid fraud. We have calculators that we can share, but it is something that we would want to basically work with the department on to validate. We've had some input from states, but in total, the state has spent roughly $3 million, and we show ROI quite higher than that from our analysis.
Well, you answered my second question about recovery of fraud versus cost, so thank you.
You're welcome.
Representative Barth.
Thank you, Mr. Chair. Bill Rowe, are you the one from the Attorney General's office? Oh, nice to meet you in person. Thank you guys for the presentation. I'm familiar with Equifax for other reasons from a benefit standpoint, so this is a little bit newer way that I've heard for Equifax to be used. We've heard about Medicaid, some of these folks, because of COVID, there were COVID dollars and things like that, so there actually may be people coming off over the next 12 months. With how the contract we have with you, are you doing anything to help us with that eligibility of who should be coming off? Are you doing anything also then to reduce our pricing as people come off? Is that changing thing? Like, how do we pay on a per incident basis, or is it just an overall flat fee?
Yep. So I'll start with how the contract is structured. It's structured with a commitment model for 600,000 transactions annually for a set amount, and then I think there's a not to exceed amount on it, but it's a commitment model for those 600,000 transactions, and essentially you get those available to the department, and the department kind of measures where they need to be. We're in the second year of a renewal on a long-term contract that is coming to an end, and so there are options to price differently. I have not had very in-depth conversations about PHE unwinding other than some conversations with the state relative to talking to other states as to how they're handling it. But we certainly believe that, we believe and want to work in conjunction with the department to better understand how, a swipe across all of those folks that are on Medicaid from an address perspective or an income perspective could help them. And I've had some conversations with the department on that. But right now, we are simply providing the work number, and that's the current contract, not any of the other services. Does that answer your question?
Not the eligibility of folks, whether they're coming off of benefits. It's only if they're coming on, or?
Well, we know that KDHE uses us for recertifications, and so they will be leveraging the work number. But a lot of the address information, as well as incarceration information and death status, quite frankly, unfortunately, is very important as people roll off. When the PHE ends, people have been getting benefits that may have moved, may have become incarcerated, or got a new job since the last time they were checked. So we're handling a portion of that right now.
And then how often is the frequency of being checked?
That is per the departmental policies by program.
Do you know off the top of your head what that is?
I do not. So for SNAP, it's every 6 months. Medicaid, it's every 12 months. But I mean, in a normal time, and that's just federal regulations. And then at application is when these agencies would check the work number, not on a regular cadence for a renewal or recertification.
Do we have a say in that at all, like where we can determine that contract and the frequency of checking on that? Is that something that we have ability to monitor or change or make sure it's part of the renewal? And what that would look like? And then the cost to do that? And because there's got to be an opportunity cost there potentially as well.
Representative Carpenter.
Thank you.
Thank you, Mr. Chair. Well, I think we can certainly recommend it, but it's the governor's cabinet agency, so the KDHE does those contracts and stuff. No, but there are a lot of safeties in place, and kind of where I would go with this is, what service are you looking at to provide now that we don't already use?
Quite frankly, we'd like to work with the department further and just understand if there are gaps. I mean, we certainly would like.
You're not aware of any gaps.
I don't know that there's any. They're leveraging incarceration through us. We bought the company that delivers incarceration. I don't know. I think that there's been an analysis of address information done by the department, but I don't know the outcome of that exactly. And I don't know specifically where they're sourcing marital status or death or financial assets, or if they know household composition, those types of things.
But you're already dealing with keys.
Keys, yes.
Okay.
We provide employment income only into keys, but
Just
none of
only employment income.
Equifax. And I don't want to speak for the department. They may be getting stuff from either state data, federal data, or another vendor.
Okay. So just committee, just for how this kind of situation works, okay. So annually you qualify for Medicare. Okay. So, and yearly, except for in the public health emergency, you're reevaluated to see if you still qualify. So when that happens, that's when we go to information systems. KEYS is our primary information system that accesses Equifax and probably another, I would venture to say we have another vendor that would use the employment information if that's all we're using from you, or the other factors that are made in that eligibility. But one of the things, interestingly, and it's kind of a little bit off subject, but we're getting ready to kick 150,000 people, or arguably 120, 150,000 folks are going to leave this. Well, so I was very concerned about the volume of that being. So I met with Conduit, which is our contractor that does our Medicaid eligibility. And I would venture to say, and I've snooped around enough and nobody's given me information about whether Conduit uses Equifax. I'm sure they use some kind of a real-time contractor, much like what the information that you provide.
I'm not sure.
I know, and I'm not either because nobody would tell me. So, but anyway, so once a month when those folks' evaluation comes up, or once a year, we will reevaluate them to whether they continue to go on the system. Well, the only interesting thing I'm getting ready to say here is when I talked to the conduit about that, because I thought they hadn't done anything for 2 years, 2.5 years, they have already went through the eligibility process whether they needed to or not. And so they already know who is eligible and who isn't. So it was interesting to me because they're already thinking ahead of the game. But so what other services, back to just, what are you asking for actually? Just point blank.
So we know we're coming up against the end of a contract term. We have more recently just started to engage with DCF and KDHE about sort of our long-term plans. I mean, we with the combination of the work number, the incarceration data, and this additional, contact information, we just believe a bundled solution, and we're going to be moving actually to a model that would have a bundled solution from a procurement perspective. And so we wanted to come here in full transparency and just say, we believe there's extreme value, like I spoke to Representative Droege, about the ROI. We think there's extreme value not only in the work number itself, but also bundling those solutions and making better informed decisions from multiple data sets in real time as opposed to a request and a response model. I mean, that's really the message we're trying to convey.
Fair enough.
Yep.
Yeah, I get it.
Okay.
Representative Ruiz.
Thank you, Mr. Chair. Thank you, Representative Carpenter, for asking that question, because that was going to be my question about why are you here? But you answered that, and thank you for that. A couple of times you've talked about instead of having caseworkers verify these things, I don't think they're doing that anyway. Somebody else is doing it, conduit for one, but other people are doing it. So I think, that's not a good presentation of what's being done by the caseworkers to do these verifications. So you've talked a little bit about Missouri maybe coming on. Okay, so they're going to be using your services, the full services that you're talking about today. Has this gotten started anywhere else, and how is that going?
Missouri's going to be our first client, full disclosure, first client on the continuous monitoring model in Q1 of this year. They're going to initially leverage work number, incarceration, as well as that contact complete, so the address, marital, and death status indicator. They are also bundling that with other data services sets that they can get through MOUs with state agencies and federal agencies to bolster the delivery of that. They are using an eligibility system in the middle to basically bring the data in. We are not in the business of making eligibility determinations. We simply provide information for the department to make those decisions. And so they're using a different system to ingest all of that data, if you will, and actually prioritize it and then, process it. Either this is a green light, yellow light, red light, for lack of a better explanation.
I have another question, Mr. Chair. Thank you, Mr. Chair. What are the risks of of doing this services, automated data services process? What are the risks involved? What are the risks for Kansas, for us?
Risks. I think that if it's set up properly with the department, I think that if you've set up what indicators you want by policy, by program, and you manage those correctly, I think that there's the risk is probably more. There's risk is more investment. There is a higher cost to getting all of these various data sets, but I think the risk right now is that you're not getting a complete picture of the applicant or the person that's on benefits right now, and that you're not informed quickly enough that there might be a change, and so they continue to receive benefits when they are no longer eligible. I think the risk is sort of staying in the model of 2015 when we originally contracted.
Thank you. Thank you, Mr. Chair.
Representative Ballard.
Thank you, Mr. Chairman. I would say that we have known for some time that we were going to have to reallocate, that this was started, PHE was because of COVID and the emergency and the quickness of everything we had to do. But I'm looking, number one, how long has Equifax Work Solutions been active?
I don't know the legal date, I apologize, but the database, Work Number database has been in existence for 20 years. I know that, so, but that,
Part of the,
it used to be Talks. Talks Corporation got bought by Equifax.
so, and it is separate from credit,
Totally, yes, completely separate.
but in terms of this, it has not been 20 years. Would you say it's been within the last 3 years?
Work Number, our relationship with Kansas specifically, it's been since the initial contract was 2015, even though I believe I worked on some contracts earlier than that. But officially, from what I saw from the presentation from DCF, it started in 2015. And that is the Work Number only. And the credit side is a completely different agency. We are not providing any credit information at all.
Well, that's what
Okay.
I'm saying. What I see here, if I look on the second page at the bottom, that current employment information is critical when enrolling, but some states and federal agencies do not have access to the most up-to-date information. Okay, so using outdated wage data to set benefit levels leads to overpayment or underpayment. What is it that you offer that would say you are more up-to-date than Department of Children and Families or KDADS or any of these other areas?
So I would point to state wage data. So state wage data or state data that comes from employers, that employers have to provide to like the Department of Labor, but it's delayed. There's very limited risk to the employer to not provide that. I think in Missouri, it's like a $25 fine per person if you don't report it. State wage data is a resource that agencies can use as opposed to the Work Number, but it's quarters, if it's months, if not quarters in arrears, and it is not a true picture of the actual income at the time. The Work Number employment income is directly from an employer, and if Walmart paid on Thursday night of last week, we have that data from Thursday night, and we're going to have it this Thursday, as opposed to state wage data being, like I said, sometimes a quarter
So in
delayed.
essence, you could be an additional resource to what we're doing. But within the department of whichever we're talking about, KDAG, KDADS or whatever, they have a staff, and their staff knows what is being required, either from CMS or from whomever, what we have to do in order to take 150,000 off the rolls. So you could be a resource. So are you saying, I don't want to paraphrase you, that you would be, I don't know the word to use, a better resource than the staff that we have, or you would like to get your foot in the door in order to be able to make that contribution as a private enterprise?
We would like to continue our partnership with KDHE and DCF. We've had it, like I said, since 2015. We believe that there is some data that's not being leveraged by the departments that could assist. But I have heard very similar things that various vendors and the department have done very well at preparing, for the end of PHE. I think the comment I would make is just, well, we truly believe that Equifax data sources are superior to state wage data, national directory and new hires, Department of Labor, UI information. It's more real time, and it's direct from the employers, whereas it's just hard to get sometimes access in a timely manner between government agencies. So I'm not looking to get my foot in the door necessarily. We're looking to continue the partnership and help where we can, and quite frankly, just be transparent about who we are, what we're currently doing, and how we could help in the future. I mean, that's the intent of why we're here. That answered your question.
Yes, it does.
Okay.
I can appreciate that. I understand what your dilemma is, or what you would like to be more involved in the process. But again, that's up to these units to make that choice. Am I correct?
Or I just have to be an incredible salesman, but,
That's all right, that's all right. No, I understand.
I mean, yes, I mean,
Yes.
yeah, we would want to work in partnership and find out where we can help, and just be more engaged. And we understand that there may be current existing contracts or places where there's sufficient amounts of data that at this time it's not a priority, or there's IT, they're balancing IT, priorities. But we want to continue to be engaged with the department at a minimum, continue serving the Kansans with the work number, but then go further.
I'm being a little critical about it, but my question, my last one would be, have you discussed this with the Secretary of these various have you discussed this with the Secretary from DDF or KDADS? In that way, are you telling us this is what you want, or have you discussed it? Because you already have a relationship.
Yep.
Okay, it's not like you haven't established it. You already have it. Have you just talked about what you could offer that you think would be beneficial with the job that we are tasked to do?
We have spoken with them about it. I will be very transparent again. It's very recent, right at the end of last year. And so we were continuing to evolve those conversations. We've been offered a meeting later in February to re-engage with KDHE and DCF to kind of go over more about what we've talked about here. But it is fairly fresh, I will say. I mean, we were known kind of as the work number people. So
Appreciate it. Thank you so very much.
you're welcome.
Representative Ruiz has another question for you.
Thank you so much for the presentation and your transparency, as you say. The risk question I'm going to ask again, because what are the risks to the beneficiaries? To those that you were essentially giving up information about?
There's two risks. They can either get on benefits more quickly or not be eligible for them. I'm not trying to be flippant. The data is available. It's available in real time. You can bring people on board more quickly with less manual work by the caseworkers, and/or I know the caseworkers might necessarily, but more calculations being done by the KEYS system, or having to move through additional screens to enter additional data. So we believe that by bundling solutions, not only from Equifax, but again, from state, other vendors, or from state, federal institutions, that bringing that all together under one person allows people, or on one screen, if you will, allows people to get on benefits more quickly. And then there is a risk. If you're not eligible, these various data sets will make it apparent.
And do they have to give consent?
So we are governed by our FCRA, the work number. I can speak to the work number. I don't want to go too far into the surrounding one, but we are governed by FCRA, the Fair Credit Reporting Act, and actually agencies, or SNAP, TANF, Medicaid, and child support agencies have access, permissible purpose they call it, to look at employment and income data when someone applies for a government benefit. Excuse me, and child support too, by the way. So, and then on the mortgage side, like in the private sector, on the mortgage side or the banking side, you actually would get presented with a document. I think some states, like workforce agencies, will present applicants with a document, but specific to what we're talking about today, these agencies in Kansas have access to that data. As soon as that person applies, they can request it. Okay.
Thank you.
You're welcome.
Any other questions? Let me ask you in that case, just kind of the mechanics of this, what you're doing in Missouri, for instance. Take that Missouri model that's going live in first quarter. You were talking about continuous monitoring, and then the respective agencies in Missouri then would define the parameters of the data that they want. And then is it upon request, or do they just ping? Like if someone gets a new job or a raise or something like that, they ping the agency, or must the agency request that?
So that is the value we believe that continuous monitoring model brings to state agencies. So in Missouri, they currently, as of today, they are doing a request response model. So if someone comes in and applies, they will check the work number. They will check CMS, data, which we provide. They will check address information from a different vendor or from state information. They're moving from that model to a model where they'll actually provide us with a baseline activation file of all of their beneficiaries. And they will then do adds and deletes, and we will monitor those. And when that case comes up for a renewal or recert, either at 6 months or 12 months, they'll say, I need info, whatever info you have for this month on that cohort of people that are being renewed or recerted. And then, depending on what program they have access to, we'll send down things that are pertinent and relative and actionable to the department for those said cases for that renewal month or recertification month. Does that answer it? Okay.
Representative Donahoe.
So with regard to that, how does the individual, first of all, he's not aware of what's transpired because you're doing it between the state. How are they able to verify, or could they ever verify, or should they be able to verify that the information is accurate?
So we do, through FCRA, we have a EDR. It's basically a report that contains what institutions or agencies have looked up your information, as well as you can request your own information. On the work number specifically, one time a year, you can actually request to see what's there. And then you can also go through a formal dispute process should there be, should you get turned down for a mortgage or turned down for a benefit. Most people that get turned down for a benefit don't really respond back, but if you get turned down for something and you really believe that you deserve whatever it is, either the mortgage or the government benefit, you have a process for dispute resolution through FCRA, through Equifax, for the work number specifically.
So how aware are the people of that fact that there is the ability to challenge it or find out? I mean, do they have to figure this out on their own, or does the triggering from the fact they didn't get the benefit trigger it, or are they notified you're not getting this benefit because of such and such information that was made available to us?
So we provide the data, don't necessarily make a decision on if they're, we don't know once that data went across if they were eligible or not. So it is incumbent on the agency to let them know that they're not eligible. And then if there is a question about why, and it comes down to you have employment or some other, they can indeed then be directed to us either via the department. We actually provide information on the website back to the caseworker sometimes if there's an issue with the data, if there's a dispute with the data, and we give the caseworker a number where they can actually call and start that process of a dispute resolution. But a lot of states are moving to a model where they want to do ex parte renewals, where it's a no-touch, where it's seamless to the applicant, unless, or the beneficiary, unless they get cut off, of course, right? I mean, it's not going to be seamless if they're notified they're no longer on it, but a renewal should not require necessarily a beneficiary to have to produce anything if you can substantiate that everything has stayed the same through third-party data sources or state data sources.
Thank you, Mr. Chairman.
Additional questions? I guess I would have one more. Right now, the contract for what you're doing with the state of Kansas is just under $3 million, you said.
Yep.
And if we were theoretically to adopt the Missouri model, we'd be talking about how much?
I am going to ask if I could follow up with that. I think we have a ballpark, but I'm not certain. I just, in the needing to talk with KDHE and DCF more, I just don't know the scope of it. And I don't want to throw out an inaccurate number.
Of course, that's
Okay.
fine.
Okay.
And today's presentation was just for information only. Requalifying 500,000 beneficiaries over the next 12 months seems like a daunting task, so we're just kind of looking at things. So we do appreciate you being here. Thank you, gentlemen.
Thank you very much for your time. I appreciate it. Thank you.
Committee, we start our budget hearings tomorrow. Some of you will be excited about that. And so I'm going to call our legislative research facilitator, Megan Leopold, and she's going to give us a quick overview of the analysis document that you'll be getting.
Good morning, or good afternoon. I'm going to start with this document that you have. This is the budget analysis for the Board of Nursing. This is one of the budgets that we'll be hearing tomorrow. Tomorrow we'll be going over the actual numbers inside the document, but today I just wanted to review the actual document. So when you get your budget analyses for the budgets that we'll be hearing this session, you'll have an idea of what you're looking at and you'll be able to read through the document. So if you look at the first page, at the very top, we have the budget overview. The budget overview shows the operating expenditures, which is everything in the agency with the exception of capital improvements. It shows the capital improvement amounts. And then it takes those and it divides out what comes from the state general fund, what's funded through federal funds, and what's funded through all other funds, generally special revenue funds. In this agency, you can see in the top that there are no state general funds that fund the agency's budget. There are no federal funds, and it's funded exclusively through a fee board or a special revenue fund. So the columns across the top, the first column, the actuals for 2020, these are the expenditures that the agency spent from 2022, and these are the actual expenditures. So this is what they actually spent. Moving forward to the 2023 budget, or 2023 column, these are the expenditures that the agency is asking to spend in 2023. So if you remember, they already have an approved budget, but this column represents the revised budget. And then directly to the right of that, you'll see the governor's recommendation for fiscal year 2023. And in this case, if you look at those two columns together, you'll see that there's no change from the agency's request to the governor's recommendation. And then you can see that the same is done for fiscal year 2024 and fiscal year 2025. At the bottom, you'll also see the FTE positions row that lays out the FTE positions for each of those columns. The rest of the first page is largely just a description of the agency. It lays out the major programs and the different roles that the agency plays within the state. On page 2 and 3 are the executive summary. This is just the broad overview of the budget. It lays out some of the larger changes, larger issues within the budget, but it's really a very broad overview. This is all laid out in more detail later in the document. But just to walk you quickly through these figures, it's an easy way to look and get a visual idea of the differences between the agency's request and then the governor's request. So in figure 2 at the top of the page, again, it's comparing that approved budget, so what the agency was approved to spend by the 2022 legislature, how they've revised it. So in this case, you can see that their revised estimate is slightly higher than the approved, and then the governor's recommendation is that bottom row. And then you see underneath fiscal year 23, there are a couple of bullets. Any major changes that are included in that year's budget, we tried to bullet out underneath it. So then I'll turn to page 4. Figure 5 at the top of page 4 is the budget summary by category of expenditures. So this is where they lay out the agency's budget divided into categories of salaries and wages, contractual services, commodities, capital outlay, as well as capital improvements. And at the bottom, you see the financing. So it's just another way to look at the way that those finances are divided within the agency. So here you can see that there, again, there's no state general fund funding, but there's funding from the Board of Nursing Fee Fund, as well as the Criminal Background Fee Fund. And together, those two funds make up the entirety of the budget. Below that is a historical look at the agency's spending. In this case, it's the Board of Nursing Fee Fund, because that's the primary source of funding for this agency. In other agencies, if it's an SGF-funded agency, that's generally what you'll see there. It just is a nice way to look at the expenditures over time and how they fluctuated. On the next page, page 5, is a chart of the fee fund. Generally, we choose one of the most major fee funds from each of the agencies to highlight in this chart. In this case, it's the Board of Nursing Fee Fund. You can see it shows the revenue, the expenditures, and also the ending balance for that fund from 2020 to 2025. Another thing to mention is that this budget analysis does go through 2025. There are a certain number of agencies, generally fee-funded agencies that don't require state general funds, that will budget out through, it's called a biennial budget, so their budgets will go out through 2025. Other budgets that you'll be seeing in this committee will only go through 2024. And then on the bottom of page 5 are the licensure fees. If it's an agency that is funded through licensure fees, these will be laid out, both the agency's current fee and then the statutory limit and where that's found. Moving forward to page 6. This is the information that was covered in that executive summary, but laid out in much more detail. I think this is one of the most helpful tables because it really lays out in all of the changes that have occurred in the agency's budget from the approved amount to the governor's recommendation. So at the top, you'll see that first line is the legislative approved amount. There were no changes made. In some cases, especially if it's a state general funded agency, you'll see reappropriations in this line. These are the changes that can be made without the legislature's approval. The next line is the agency's revised estimate. And you can see that the agency added a supplemental in this case, and it's labeled number 2. So if you go down to the bottom, you can see that there's a number 2, and that is just a description of that line item. So in the table is the amount, and then you can scroll down below to see the description. So in this case, there is a supplemental for licensing software as well as a change in the criminal background fee. And in the next column, number 4, is the governor's recommendation. In this case, there are no changes. If there are changes, you'll see those laid out just like the agency's changes. And again, they'll all be numbered with a description below. On page 7 is a table that maps out the changes from the actual expenditures. So again, this is looking at the actual expenditures of the agency in fiscal year 22, and it compares it to what the agency has asked for in fiscal year 23. And then underneath is some narrative explaining why there were any major shifts. And then the next 2 pages, page 8 and 9, again, it's just like that fiscal year 23 table. It shows for each of those fiscal years the changes that were made by the agency and the changes that were made by the governor with descriptions below. Moving forward to page 10. Any agencies that have supplemental or enhancement requests in their budgets will have a page that maps out those the amounts of the supplemental and enhancement requests as well as a summary. So this is just information about what the agency has recommended or what the agency has requested. And then at the bottom it says that the governor does recommend the adoption of this request. If the governor does not recommend it, it'll say that. On the next page, page 11, in each of the budget analyses, well, most of the budget analyses, you'll see a special topics page. These are topics that have been of note in the budgets in past years. It could be legislation that was passed that impacted the budget. It could be something that is changing within the agency, but it's just a nice reference for items that might come up throughout the budget process. In this case, the Board of Nursing entered into a nursing licensure compact. This allows nurses from other states to be licensed in just one state, but practice in other states. And this has had an impact on their budget, so there's a summary of that. There's also some information about ks, which is a prescription drug program that the Board of Nursing used to help fund, and they no longer do. So this page will differ depending on the agency. Page 12 breaks the budget down by programs. In this agency, there's only one program, administration, which encompasses the whole of the agency. In other agencies, you'll see they have several programs. And this is where you can see those programs broken down by funding. It also breaks down the FTE positions by program. And then on the last page, page 13, are the agency's performance measures. Each of the agencies submits performance measures that they use to help guide their performance. And these are all listed out in this section. I'm happy to stand for any questions about the document.
Committee, questions for Megan? Representative Ballard.
Thank you. Thank you, Megan. That was really good. Would you just explain? I just remember when I first started looking at these budgets, it was a little confusing for me. Page 6, I think that's the first time it appears. Okay. 6, like 3, number 3, under the chart, like the 30 in parentheses. Would you just explain that? And again, it appears at 88,000, okay?
So the parenthesis, anything that's red and in parentheses is a decrease. So above it, they added 189,000 to their budget, but they also decreased their budget by the 30,000.
Is there anything that says in what areas in criminal background fees, they tell you why? And that is only in what, 25, 24?
This is in 23. So any changes that are in that table will correspond to the top where it says the fiscal year. And then beneath that will be a description of any of those changes. So it describes why there was that decrease as well as why there was the increase of 189,000.
Okay, thank you. Thank you, Megan.
Other questions, committee? Representative Clifford.
Thank you, Mr. Chairman. The revenue, is that net of the 10% transfer to the state general fund, or is that all in before the transfer?
No, that's after the transfer's been made.
So, okay. And tomorrow we start the 8th month of fiscal year 23. Is there any data provided to the committee on where we're at in our current fiscal year?
No, there isn't data on the current fiscal year other than what they're asking for it compares to the approved. That's why we have the actual information in there. So the actuals for fiscal year 22 are the closest we have.
Thank you, Megan. Thank you, Mr. Chairman.
Committee, other questions? And do you want to go through kind of the process tomorrow? So, I mean, we'll hear the budget and then we'll have someone from the agency. So if you want to elaborate on that.
Okay. So the first step will be the budget hearing or the KLRD analysis. So the KLRD analyst assigned to that budget will come up. They'll go through the document that I just presented, and you'll have a chance to ask any questions about the budget. The agency will have an opportunity to come up after that. Some agencies will provide written testimony. Others will just stand for questions, but you'll have a chance to ask the agency any questions you have about the budget. And then following that, generally a day or two later, the committee will make recommendations on the budget. And I have some information on this second sheet you have about the report out procedure. So again, the report out is when the Chair Mason, will take the recommendations that came out of this committee to House Appropriations and report out to House Appropriations what the committee's recommendations were. And then House Appropriations will have an opportunity to adjust those recommendations and then approve. So the process for getting this committee's recommendations to House Appropriations is that the committee will have an opportunity during the recommendations date to submit any recommendations that any member can submit a recommendation. The committee will then have a chance to vote on it. And then a final report will come out of the committee that details each of the recommendations that the committee approved. That report I'll write up, the KOD analyst that's handling the budget will provide a PDF copy to the committee. And the committee will have an opportunity to verify that that report is ready to go to House Appropriations. So members will be emailed a copy. Generally, it'll be the next day. Sometimes it always has to be before noon, the day prior to the report out, to give the committee members time to look it over. If it's, if budgets get backed up and there's a shorter timeline, then we'll be in contact about that and do everything we can to give you as much time as possible. Once you get the email, we'll ask you to reply by a certain date if you have any changes that you feel need to be made. The changes are things that you feel are inaccurate. So if I worded a recommendation in a way that you don't feel reflects what the committee voted on and approved, then that would be feedback that I would need, and then we can run it back through the committee. I'll make those changes. You do not need to reply. If you receive the subcommittee report, you look it over, the recommendations look okay, and you do not reply, then we will take that as meaning that you are verifying that this looks okay to move on to the next step. Agreement means that you believe the report is ready. It does not necessarily mean that you are in agreement with every recommendation. And there is a opportunity to provide a minority report. If that is something you want to do, you can reach out to me or the analyst, and that's something that we can help add to that committee report. Are there any questions about that process?
Representative Carpenter.
Thank you, Madam Chair. Megan, you just might want to go over the process for having them prepare committee recommendations. And committee, just be sure and ask if somebody's already got the same recommendation, so Megan doesn't have to do it twice. But a lot of times there may be, throughout this committee, there may be someone that has the same recommendation, and that you can fight over who introduces it. But
yeah, if you have recommendations that you would like to add to a subcommittee report, you can email them to me prior to the date when we do the agency recommendations. That gives me an opportunity to write it up in a way that I feel matches what your intention is, and it saves us some time on the back end, making sure that I word it in a way that's appropriate. If you have a recommendation that you don't want to send to me ahead of time, that's perfectly fine. You can make them spur of the moment during recommendations as well.
Representative Hobson.
Question to the chair. When you say recommendation, is that like our individual recommendations versus a recommendation from the committee? Is that a separate?
So
I guess what I'm asking is, we all have individual recommendations per se, but at the final, will the committee have like a recommendation compared to like an item if we wanted to recommend a particular number per se on a budget item? Does it work that way after we're done with the budget?
Well, so in this committee, after we hear all the agency information, we do. So every committee member will have an opportunity to bring any recommendation, and then the committee votes on each one. So then those that are approved by the full committee will go into the subcommittee report.
Thank you. I think that's right.
As an example, Representative, if you looked over the Board of Nursing budget here and you thought it should be raised by a couple dollars or $10 or $100,000 or whatever, you would bring that recommendation, we would discuss it and vote on it. Any other questions, committee? Is there anything else you have, Megan?
That's it.
Okay. Well, thank you very much. Committee, we'll start hearing budgets tomorrow, and we're adjourned. Thank you very much.